Hi everyone, I'm Ben Gonzalez. This is TDI. Well, this is the time of the year when a lot of us are looking at our health insurance for the coming year. So we thought we'd offer some tips about how to compare plans and shop for insurance. And joining us is Misty Highnote from our Public Affairs Office. Hello, Misty.
Hi.
Well, the open enrollment period for ACA plans starts in November and runs through December 15th, but even if you're getting your insurance somewhere else, you need to know how to compare the plans. So, what are some tips? What are some things to remember, Misty?
Right. Number one is you want to make sure you know what you're buying. So we're all used to traditional health plans that provide the benefits and the coverages that we use when we go to the doctor and get medicine. But there are a lot of different types of plans. If you're looking at cost alone, there are a lot of cheaper plans. But you also want to know what those plans are. Some of them aren't traditional health coverage. Some of them are discount plans and different types of plans. So you just really want to know what you're buying.
So, with all those different kinds of choices out there, how do I know I'm getting the right thing for me or me and my family?
Right. And you definitely want to ask questions of yourself. So you want to know your doctors, your medicines, because when you're looking at a plan, you want it to be able to pay for the doctors you see, the medicine you use. So when you're looking at the plans, the agents and companies should be able to tell you what doctors are in their networks, if they have a network, or if they don't. You want to ask that too. So if you have some medical conditions and you see a certain specialist or a certain doctor, you don't want to change plans and then not be able to see those. So you want to ask about your doctors, you want to ask about your medicine. If you have certain medicines that you take and you really need those medicines still, of course, you're going to want to ask if the plan covers those medicines. So there's just some questions you need to ask for yourself and your family.
So, you start off by asking yourself what's important to you, and then you can ask others if that's what's in their plan.
Right.
So I guess one of the big things, of course, for a lot of us is how much is this going to cost me? And so on that front, is there? I guess it depends on what you choose, right?
Right, exactly. Yeah, there's a wide array of costs. So when you start shopping around, if you go to the website or if you get a quote, you're probably going to see that one premium amount. And that's probably the first thing that's going to catch your eye. And that is important because that's what you're going to be paying every month for that plan. But you also need to know that there's other costs that go into that plan. So when you go to the doctor, there's going to be a copay probably. You want to know what that amount is. There might be a deductible. That's the amount you have to pay before your company starts paying. So that's important. And then there's co-insurance. That's the amount you have to pay if you get a procedure, you go to the hospital, you have to pay a certain amount of your care. So you just want to really know, other than a premium, what are costs that are coming out of my pocket? And then you'll also be able to tell if you have a low premium, a high deductible, low premium. Just know that there's probably some give and take there. If you see a low premium, look at that deductible because there's a good chance that's going to be high. And that might be fine for you if that's the choice you want to make to save on premiums and have a high deductible. Talk to your agent, talk to your company. If that's the choice you want to make, great. But just be aware of the cost.
Yeah, and I guess ultimately the lowest cost stuff is probably going to have cover less, and there may be some limits to it as well. So whenever a lot of people are looking for a product, there's going to be somebody that wants to try to take advantage of it. So what can we do to avoid any scams that are out there?
Right. So one of the biggies is an agent or a company that can't answer your question. If these agents and companies are selling plans, they should know inside and out how their plan works, what it costs, what it covers, and you should be able to ask that of any agent and company. So if they don't know that, that's a big red flag. You also want to look out if an agent or company says limited time offer. You have until December 15th to buy a plan. Don't let anyone rush you. You should be able to take all the time you need to decide, to compare, to ask questions. So don't let anyone rush you. Those are all big warning signs that maybe you want to try a different company. There's a lot of companies out there, so don't feel pressured to use one or another. Those might be some signs to start looking elsewhere. And you also want
move on to the next one on your list.
Right, move on down the road, yeah. You also want to watch out if you're looking for an Affordable Care Act plan, you want to make sure that's one you're getting. Those ACA plans have benefits that are required by law, so if that's the plan you want, great, but you want to make sure that's the plan you're paying for. So watch out if you see plans that say bronze, gold, silver. Make sure those are ACA plans because a lot of companies might use that marketing and it might not be an ACA plan. And then finally, you want to watch out for callers. If you get a call, and it might come in from a certain company, you might look at your phone and say, "Oh, that's the company that I'm, buying from." But they're also able to spoof phone numbers. So even though that's the company coming in, that might not be the company that you want to talk to. So maybe, pick up the phone and ask the person, what's your name, and then call them back on the number that you have. So watch out for those numbers too. Yeah. So just got to be careful.
You can't even trust caller ID anymore. Well, that's a lot of stuff to keep track of.
Yes, it is. It is. And on our website, that's a good place to start. On our TDI website, we have a great shopping guide. So we try to condense it to one page and have some of the major questions, some of the stuff I went over today, and more. So just things to keep in your mind and to ask your agent or company. So check out our website for that shopping guide for sure.
Okay, thanks, Misty. And you can find that shopping guide on our website. It's tdi.texas.gov. You can just put in shopping for health insurance in our search engine at the top, or you can call us on the helpline. That's 1-800-252-3439. We've got people there during weekdays ready to answer questions for you. So for Misty High Note, I'm Ben Gonzalez. This is TDI.